Efficacy table, example for hypertension, clinical trial study. Introduction. Here's an example layout for an efficacy table in a hypertension clinical trial. This example compares two groups: a treatment group receiving a new antihypertensive medication and a control group receiving a placebo or standard therapy. Key efficacy endpoints in hypertension trials include reductions in systolic and diastolic blood pressure control rates, and improvement in quality of life. Efficacy table, example for hypertension, clinical trial study. Explanation of key components: systolic and diastolic blood pressure, SBP, and DBP. Reduction. These primary endpoints measure reductions in SBP and DBP from baseline. The treatment group shows a greater reduction in SBP, minus 20.5 millimeters of mercury versus minus 8.2 millimeters of mercury, and DBP, minus 12.3 millimeters of mercury versus minus 5.5 millimeters of mercury. Then the control, indicating effective blood pressure control. Proportion of patients achieving BP less than 140 over 90 millimeters of mercury. This endpoint shows the percentage of patients achieving the target blood pressure, less than 140 over 90 millimeters of mercury. A higher proportion in the treatment group, 75% versus 45%, suggests better efficacy in reaching controlled blood pressure levels. Mean change in pulse pressure. Pulse pressure, SBP minus DBP. Reduction is associated with cardiovascular health. A greater reduction in pulse pressure in the treatment group, minus 8.0 millimeters of mercury versus minus 3.0 millimeters of mercury, suggests an improvement in overall vascular health. Quality of life score. Improvements in quality of life specific to hypertension symptoms are measured here, with the treatment group showing a higher increase, plus 1.2 versus plus 0.5, indicating that patients feel better overall. Reduction in left ventricular mass index, LVMI. LVMI is a measure of heart health, with a reduction indicating less heart strain. The treatment group's greater decrease, minus 12 grams per square meter versus minus 4 grams per square meter, shows the therapy's positive effect on cardiovascular remodeling. Safety outcomes. This section includes the incidence of serious adverse events and treatment discontinuation rates due to adverse effects. Similar rates between groups suggest a comparable safety profile for the investigational therapy. This efficacy table format offers a detailed summary of the therapy's impact on blood pressure, cardiovascular health, and quality of life, helping stakeholders assess the treatment's overall benefits and safety in managing hypertension. Efficacy table, example for hypertension, clinical trial study. Many thanks for watching my video and happy learning! Please like, share, subscribe, leave a feedback comment. Many thanks for your support and having great connection.